Hello, hello, and good evening to all of you who are listening in to our Protecting the Vision webinar sponsored by the National Optometric Foundation in connection with the National Optometric Association. My name is Dr. Timothy Brown, the treasurer for the National Optometric Foundation, and I am excited to have another webinar here at the end of 2023. We have made it through an entire year and we have been sharing education with the public for free, having different doctors on our webinar, sharing their wisdom with you. And I'm excited about the did I say two? Yes, two fabulous doctors who's going to be on sharing with you tonight. And I'll introduce them later on the show. But let me tell you a little bit about the National Optometric Foundation and what we do. The National Optometric Foundation is the financial arm for the National Optometric Association, our parent company for the NOF, and also for the NOSA, the National Optometric Student Association. And we go along with the NOA and support the community in various ways as far as education, being a resource for them, providing free eye exams, free eyeglasses for the community. We do free eye exams and give out free glasses every year at our National Optometric Association convention, along with VSP and our fabulous sponsors who make the things that we do each year possible. We appreciate them for donating their time and their resources and their finances there to give us the opportunity to be able to be a resource for the community. And I'm so thankful for all of our doctors who have been on the webinar this year, sharing their wisdom, as well as the two docs who are going to share with us tonight. We try to also support students who are thinking about going to optometry school, students who are currently in high school, trying to decide a career, and we're there to walk alongside with them and introduce them to the field of optometry and give them an opportunity to be able to explore different things that they may find interesting and be able to pursue optometry as a career choice for them. We also support students who are currently in optometry school. We do scholarships. We have different people who donate funds to help us be able to give scholarships to deserving students based on their scholarship, their academics, while they're in optometry school, trying to help those students also get to our National Optometric Association conventions. And in 2024, in July, our convention is going to be in the city of brotherly love. That's right, folks. We're going to be in Philadelphia in July 2024 at our National Optometric Association convention, and we are looking to see you there. And this is all in the name of love. So give me the opportunity to be able to introduce our guest speakers, and we'll get started with some great things that they would like to share with our listening audience tonight. All right. Thank you guys for being a part of this. Thank you all who have supported us throughout 2023. And we look forward to educating communities, especially when it comes to the three silent killers of your vision, which is diabetic retinopathy, glaucoma, and hypertensive retinopathy. We're going to continue to share about those things all throughout 2024. Now, if you would like to follow us, we have a website, National Optometric Foundation.com, that you can follow us, find out more about us, who our officers are, and a little bit of history. We post photos on there as well. If you would like to follow us on Facebook, we have a Facebook page under the same name, National Optometric Foundation. We are also on YouTube. We have a YouTube channel. You can go back and look at our previous webinars and stay in contact with us for our future webinars as well, National Optometric Foundation. And if you too would like to be one of the people to help us continue to do the things that we do, supporting students and supporting the community financially, we have a Cash App, and you can do so tonight. It's $ Protecting the Vision. We are a nonprofit organization, so you can have a tax write-off as well for your donation, and we thank you in advance. So let me get started here and introduce our guest speaker, Dr. Luis Trujillo, fabulous guy. Not only is he an optometrist, he's also my friend, my brother. We have some history together. He's the associate professor at Salus University, graduate of Pennsylvania College of Optometry at Salus University. He graduated in 2009, and he completed a residency in pediatrics, binocular vision therapy in 2012. He has worked in various modalities of practice throughout the year, including serving in pediatrics department at the Eye Institute in Philadelphia. He's also spent some time working with the mobile health units as well as in the local school districts to provide eye care, to provide the eye care for those in need. He spent 2018 to 2023 working with the uninsured and underinsured in a federally qualified health center in the greater Philadelphia region. And he's currently pursuing his master's degree in theology. Watch out now, in theology with a primary concentration in bioethics, ethics as they pertain to health and healthcare practice. So I'm excited to have my friend, my brother, Dr. Luis Trujillo, as one of our first guest speakers for tonight. Let's bring him on the show. Dr. Trujillo, thank you so much for being our guest speaker on the show. I'm excited to have you on sharing with our listening audience tonight.
Oh, thank you, Tim, and thanks to the National Optometric Foundation also for having me on.
Absolutely. We are thrilled that you said yes when you got the invitation to be on to share with us. And we are just excited about you sharing on the topic there when it comes to medical ethics and telling us about different types and going to a little bit deeper into some of the things related to ethics there. I know your experiences have given you some insights, and you want to share a few things with our listening audience there to educate them and let us know a little bit about what you do. So, but before we get too deep into that, I just want to slow down for a moment and just say, it's been a long time since I've seen you, my friend. I mean, like I got out of school, I went back to South Carolina. You're in Philly. You've been representing there at the Eye Institute. You've been helping these people in Philadelphia that's been in need. I mean, we did a lot of this when we used to do the vision screenings throughout the Philadelphia area there. And I'm happy to hear that you are still making a positive impact in different communities throughout the city of Philadelphia there. So thank you. First of all, thank you for doing that and for your contributions there. I know sometimes as professionals, as leaders, we don't always hear that thank you coming from people there. We may hear it sometimes from the patients there, but I just want to take this opportunity to say thank you for what you have done. So you are affiliated with the Salus University as an associate professor, and I want you to just tell us about how long you've been doing that, how you came into that role there at Salus University.
Sure. Yeah, I was, like you had mentioned, I finished my residency in 2012. So what I actually did was I graduated in 2009, and rather than go straight into doing a residency, I actually went out to work in the eye doctor place. We were able to go in there and get them a couple pairs of glasses, and we did a full exam on them. And so that was essentially back in, I want to say 2012, 2013 timeframe. And I just kind of been with them ever since. Slowly, and as the years went on, I was doing more work within the clinic at the Eye Institute myself, and then like I said or like you had mentioned in the bio, I essentially went to go work at the federally qualified health center through Salus. So this was Salus kind of sending me there to go work in that particular modality of practice. And so it's been a rewarding career thus far. And that's just essentially how I got started. And here or there, I've taught some classes. I do teach primarily now only in a few labs. And then I don't know if you remember the labs back when you were a student, sir. Yeah. But those are always very educational experiences, yeah. And I think that they're pretty they're pretty fun for me, actually. And then I do also do a few lectures within the binocular vision and pediatric arena for the international students. So if you're not aware, Salus does offer master's degree to essentially doctors from other countries, and they come here. They want to get a master's degree just to get really what it is that they want, the knowledge that they can obtain here in the United States, and particularly at Salus, and they use that when they go back to their respective practices and countries. And so that's the kind of the gist of what I'm currently doing and what I have done through at Salus.
Absolutely. That's fabulous. And I listen and I hear you say that you've helped and you've been into schools, you've been into Hispanic community, just like the NOA strives to do, going into areas that's underrepresented as well as underserved there. So I appreciate you for taking those walks into the community, using your skills and your knowledge to help people get their eyes examined, get access to glasses that they may not have been able to afford or have access to those resources. That's important. And we want to encourage other doctors. You know, some of you may be listening to this webinar and you are a doctor and you want to get involved, you don't know how to get involved, or you've been procrastinating. I want to encourage you to get started. Get started somewhere. It doesn't always have to be a mission trip in a different country. It could be local work in your communities around you that can make a big impact more than you realize there. So I'll just say start small and get connected with other doctors who may be already serving in that capacity there. And let's just continue to make an impact in communities. You know, it's fabulous. You know, Sharita and I, my wife and I at Insight Family Eye Care here in Augusta, Georgia, work with children, you know, pediatrics. And I noticed that you also decided to get into the pediatrics and binocular vision and vision therapy. You know, that's what Sharita does a lot on Tuesdays and Thursdays there. So I just want to see what brought you in that direction, your passion for going into those areas there for optometry.
Yeah, so the question is, why essentially did I choose to go back and do the pediatric residency? And what I had decided to do is, like I said, I decided to work primarily after graduating without doing a residency. And when I was at work in working in Center City, Philadelphia, I found that I had a lot of patients that came in who were professionals working in that area, and they had what those of us in the optometric community call binocular vision or accommodative complaints. So they basically were coming in with issues that were related to the functioning of their eyes, how they worked together or how well they didn't work together. So I kind of felt that was something that I wanted to learn more about. And then I also realized that whenever I had a pediatric patient come in, it just kind of made my day. It essentially, children are not adults, and sometimes adults, and you know, the gravity of the problems that they have are not necessarily the same as those that the children had. And you know, from my perspective, I rather enjoyed, you know, kind of being myself. I'm a bit of a jokester, and I think you know that, Tim.
Yes, you are.
Yeah, and so I think, you know, when you can joke a lot more easily with children than some adults, they, you know, at least when I was working in that particular practice, they were there on their lunch hour, or they had 15, 20 minutes,
Right.
and they were not, you know, it was business. So
Right.
I get that, but you know, I felt that my world just kind of opened up. You know, when I had to do an exam on a kid versus an adult, and then going back, I thought, you know, in order to learn more about the binocular vision issues and how to remedy them with something like vision therapy was something that I wanted to do. And so I went ahead and did that.
Yeah, I can say, you know, your whole demeanor changes, you know, when you're dealing with children compared to adults, you know. And when you see that moment when their face lights up, or you may give them a treat or a sticker, you know, for doing so well at the end of their exam, and their face lights up just from those little things there, or you have to, like you said, joke around with them, or change the tone of your voice, you know, when you're dealing with them. You know, I hear Sharita all the time in the exam room talking to the children there. And even when they come out, you know, and they're dealing with their glasses or anything else in the office that we may need to do extra with them, it's just a different feel. It's a different feel when you're dealing with pediatrics there. So more of that is needed. There's a lot of not there are not a lot of optometrists specializing in pediatric care. And I think that's important. I also think it's important, Doc, what you've also decided to do with the mobile health clinic. You know, that care is important in the communities there as well. So we've talked about you coming to Salus. We talked about you doing your studies in pediatric vision therapy, binocular vision, and now let's talk a little bit about what is the mobile care unit all about there that you're connected with, and why is that important for that to exist for the community?
So I think it's just the bottom, it just boils down to the fact that mobile healthcare is something that not only in the optometric realm or world, it's something that's necessary throughout, all of medicine, I think. The reason is that just not everyone can make it to a brick and mortar place. And there are various reasons for that. And, it's too complex of an issue, I think, to get into. But just kind of, we sometimes take it for granted that, I'm sick, I need to go to the doctor, or I got to get my eye exam, or I have to go to the dentist. Not everyone can do that. And I think that's the big push for mobile healthcare. I was, like I said, I didn't know what I was getting into when they asked me, Salus asked me to participate all those years ago. But I'm glad I did. It is rewarding,
Yeah, yeah. The president of the National Optometric Foundation, Dr. Andre Whitehead, is also connected to the mobile healthcare units as well. And I think they play a vital part in communities there. So looking forward to them coming to our Augusta, Georgia area as well there with their mobile unit. Your mobile unit is pretty much staying there in Philadelphia. Or did they travel around to other
Yeah,
cities?
no, it's essentially it's a Salus owned vehicle, and we
Okay.
go out to the different schools in the greater Philadelphia region, including Philadelphia itself. I have worked separately with VSP, I think, as you have mentioned, and they're a great company, and they also have their mobile units, and we do a lot of great events, and we're connected with them as well. These are the this is it's I cannot say enough good things about VSP and the folks on their teams. You
Wow.
can tell that they're really
Amazing.
devoted. Yeah, they're really devoted to getting glasses to people, and providing vision, healthcare. Obviously, if there's any need for medical care, we make referrals. But yeah, so generally, it's mostly with the Salus unit, and then apart from that, a couple of events throughout the year with the VSP.
Right. So for those who are listening, you hear us talking about this mobile healthcare. Um, how does it look, Doc? Describe it to them if they are entering into this mobile healthcare unit. What would they see when they walk into that unit there, just so that they can know about the inside and everything to have a
Yes.
vision?
Generally speaking, if you've ever been into an eye doctor's office where they actually do the eye exam, that's what it looks like on the inside of the mobile health care unit that we use. They're all different. They all are ordered and customized to whatever company and or provider uses them. And ours, you walk in, you have a little area for paperwork, a little area, where we have an exam chair, and then another little area where the patients or children, mostly because we're at schools, get to pick out glasses, and it's all funded through donations. That is a big thing, a big push. Throughout the year, Salus does raise funds, and we get to use them, and each child gets 2 pair of glasses, one they can take for home use and one to leave at school. So and then none of that would be possible without the administration and the people that fundraise.
Absolutely beautiful. That's amazing, and that's an eye doctor's office on wheels right there. So
Basically, yes.
when you walk into that unit there, it's going to be like you're in a doctor's office. You're going to get excellent care. So there's nothing minimized. I just want them to understand, if you're listening, when you see these units, or you have the opportunity to be able to go to one, go. It's an optometrist doing the eye exam on a mobile unit there, trying to come to the community. And that's what we do when we have our free eye exams and free glasses at the National Optometric Association conventions each year as well. VFP is there. They got the frames. They have the mobile unit there where they can cut the lenses for some of those prescriptions and have them ready the same day. And then there are rooms on that mobile unit for an optometrist to be on there doing eye exams as well. And we do some of the pre-testing, when we are doing vision screening during that time as well. So I will get the information to you, Dr. Trujillo, and some of your buddies. You can come down and join us. In July, we'll be in that city of brotherly love there. We would love to have some of our stylist colleagues there with us as we're giving those free eye exams. But I'll give you more information about that.
Yeah, yeah. No,
yeah.
I'd love to be great. Yeah, forwarded. Unfortunately, you're my only buddy, so it's just going to be.
Oh, I feel honored. And I heard also we talked about the federally qualified health center as well. What has been rewarding for you when it comes to being connected and doing that work as well?
Right. So I was there for about 4 years. It was through Salus, and the rewarding aspect of that was that we get to see, and this is, by the way, where I met Dr. Cardo. So, she worked there as well. It's a situation where you again, we take a lot for granted here in the United States with regards to healthcare. We don't by any means have the perfect healthcare system, but by and large, if you have insurance, you can get seen by a doctor. These places are established brick and mortar doctor's offices that, where a patient that does not have insurance can just come regardless of their immigration status, anything like that. They come and get care, primarily funded by the federal government. The place that I was working at, what I found rewarding was just that. The patients coming in, they're so grateful because they get artificial tears. We give them a sample of something, and, now we would give them a full exam, and there's a lot of diabetes in the population.
Right.
We could at least make referrals, and or their primary care physician and dentists were also in that same building, and so they would be almost immediately made aware of any issues that were in the eyes as that pertaining to their overall health. And so things like diabetes, glaucoma, like you mentioned, all those things are very prevalent in the Hispanic community. And I think that that was most rewarding to me, was because I'm Hispanic, just getting a feel to, it's just, warm, fuzzy feeling when at the end of the day, when you know that you did what you could for other people that are less fortunate, and hey, they're of your same ethnicity, and that's not a bad thing. And so, that was a rewarding experience. Those places have their setbacks and they have their issues as well. And, but by and large, they do serve a good purpose, and they're throughout the entire United States. So it's not something that's particular to Philadelphia.
Right. And I'm proud of you for taking that step back, giving back to the community. Again, underserved, underrepresented communities there, offering that care that's much needed there. And that leads me to our next discussion, which was on the flyer, moving into medical ethics, bioethics there. You're studying that for what reason? Tell us a little bit about, how you got connected to that, because you've been very busy since the last time I've seen you there. So.
Yeah, well, it's as a physician, I think that there are times when you're dealing with a patient, you may or may not question, what am I supposed to do here? What is the right thing to do? Right. And in my educational, unfortunately, I'm not saying it wasn't presented in the way that in any way or shape or form, but I think that the way it's being presented in this degree program I'm in it's more of a systematic way, and it's something that I think that a lot of people can benefit from if they even just knew about it. Physicians, I mean, as well as patients. And so I think that's the primary reason, or what is driving me towards it. But it kind of all started from working at that federal center, because there are a lot of things that challenges that the providers face every day, challenges that the administration faces. And I would always, feel rewarded for working with the patients, but also sometimes leave with a sense of, did things play out today with every single patient the way they should have, and the way they would have maybe in a place where someone did have insurance. I don't know if that quite makes sense, but that's exactly what kind of drove me to, like I said, major in this bioethics. And so, yeah, it's actually fun, I think.
Right. Yeah. And so, doctors, patients, we're all different. We come from different backgrounds, we don't think the same, we don't act the same, I'm just interested in wondering how medical ethics play a role in that, from people from different backgrounds
Right.
and everything. If you want to just dive into that a little bit for us
Sure.
as well.
Yeah, so there's definitely different methods to ethics or bioethics or medical ethics, however you want to call it. There are, essentially what I can tell you from what my experience has been where I've worked, particularly even now at the Eye Institute. And this is not something that was ever told to me. I just learned that this is how we do things after having taken the course. But some physicians kind of base their modality of practice on what is just the standard of care, what has been established. What do I know with this case that whatever I'm dealing with, I should do what this standard is. And that's kind of my where I draw the line on, I'm not going to do anything worse or I'm not going to do anything short of that goal. So that's called, just like I said, just it's the standard of care. Other doctors may integrate the standard of care with what we call like case-based ethics. And so, in certain cases, then you take it to a, more of an individualized level. So every time you have a case like this is how, you would present it. And then overall, over time, if every time you're presented with this same type of a case, then you would have an established ethical norm, if you will, for the particular practice. The kind of practice that I kind of really gravitated to, or really feel that is more of a overall system is something that's called principalism, or just talks about 4 principles. Of which, I'm going to name them off if that's okay. And this is, I know we said we're not going to get into technical terms or anything like that, but this is about as technical as we're going to get. And the first one being autonomy. So, if every doctor can ask themselves when they're dealing with a particular patient, is the patient being involved in their treatment or their care? So are you, as a doctor, saying, Mr. Smith, this is your options. I'd like you to consider this is the best thing for you treatment wise. That's why I'm offering it to you. So that's the first principle. The next principle would be something called beneficence, or, how am I benefiting the patient? So every doctor can ask themselves, how is the treatment that I'm offering them going to benefit them? And will it benefit them? Because I think that there are treatments out there, not just in the optometric world, but in all over medicine, where you can offer the patient something, but is it really going to benefit them? And so I think that's something that you want to ask yourself. Non-maleficence. So I'm not going to make sure that I'm minimizing any harm, right? You want to give the patient a treatment that's not going to cause them harm. And that's, I think everyone, that goes back to the Hippocratic Oath, right? And then the last one, the last one is justice. So equity and care. Does everyone get the same care? And I think that's where one of the biggest challenges are, when it comes to medicine or, healthcare in general. So justice, does every single patient get offered the same type of care? And if not, why? And so those are the, these were 4 principles that were essentially developed back in the late 70s, early 80s. So every physician can maybe try to apply these in an equal manner. That I think is what the challenging part is. And so that's
and you would probably say that's why it's important for both the doctor and patient to know about these models that you just outlined for us there.
Yeah, exactly. Yeah, thank you for that. Every patient, if you're ever questioning is what my treatment is, the treatment being offered to me ethical or whatever. I don't know how many I certainly have. If I'm, at the doctor, I'm saying, is this right? But maybe that's just me. But as a patient, you can sit there and say, is the doctor including me in my care? Are they including me in the choices that are allotted to me? Is the treatment going to benefit me in some way, or is it not? And I've had patients ask me that as well. So, and then, obviously, what is the potential harm? And then again, the justice. I think the justice is one of, I guess my favorite because it's a more challenging one. Is the doctor? Do I feel the doctor is offering me the same care they might offer, Joe Schmo down the road, or their next patient? And so, yeah, as a patient, you can certainly take all those and make you use that as a measure of whether or not you want to, assent to whatever treatment they're offering and that sort of a thing.
Right. And, definitely, want to go into something a little bit, deeper with you when it comes to other things. But that's one of the things that I like about when I go to my primary care doctor is that we can have a conversation. He brings me into the thought process and the decision making. It's not like he just say, I'm going to do this, this, and this. He say, what do you feel about this? How do you feel about this? He say, well, I want to make sure that I'm making the right decision for your benefit. It's not like I'm telling you to do this. I only want to do it if it's going to benefit you. I like conversations like that. Yes. So I say that to say to the listening audience, if you're listening, be sure that you are with a doctor who's having a conversation with you, regardless if it's your dentist, your optometrist, or your primary care doctor. The conversation should go back and forth. It shouldn't be just a one-way thing. It should be going back and forth there. So that's why we do talks like this, so that we can dive into different topics and educate the public, educate communities, so that you are more aware and you can be a better advocate for yourself when it comes to your health care. Dr. Luis Trujillo, thank you for sharing the knowledge that you've shared. I do want you to come back later on. Perhaps we'll have you on the screen when Dr. Cardo will be up here. She might talk about a certain case study, and we can get a little bit deeper in some of that as well there. But I'm thankful that you've shared the information that you've shared there. And before I do an intro to Dr. Cardo, is there anything else that you would like to say that maybe we didn't cover when it comes to medical ethics or your work that you've been doing in the community?
No, just that I think that if everyone would keep in mind those 4 principles, that I think that the healthcare arena itself would just be it would be a step in the right direction, I think, for both patients. And I agree with you. There should be a conversation between the patient and their doctor, not just a one-sided type of a thing. But
absolutely. Thank you, Doc. Appreciate it. I'm going to take the show back for just a few seconds here while I get ready for Dr. Cardo to bring her on there. Again, thank you. And I'll see you later on near the end of the show, okay?
All right. Thank you.
Yes, sir. So, folks, we got another great speaker who's going to share some information with us with her background, where she's at, what she's been doing as an optometry student, as a clinician, currently as a resident, and that is Dr. Cardo there, Dr. Dariela Cardo. She was born in Cuba and moved with her family at the age of 6 to Miami, Florida. She completed her bachelor's degree in biology at the University of Florida. She went to obtain her degree in optometry at the fabulous Pennsylvania College of Optometry at Salus University this past spring. So welcome to the profession, Doc. New grad, where she is currently completing her cornea and contact lens residency. Dr. Cardo splits her time at Dr. James Lewis Cornea Anterior Segment Private Practice in Elkins Park in the Eye Institute, where she focuses on specialty contact lenses. Yes. Thank you, Doc. We welcome you to the show. Let's bring Dr. Cardo onto the show. Thank you for coming onto the show to share a little bit about what you have been doing, what you're currently doing, and also talk with us a little bit about those specialty contact lenses in the cornea there. So welcome to the show.
Hi, thank you, Dr. Brown, for having me on your show. It's quite an honor to be doing this so early in my career.
Yes, yes. And guess what, Doc? The best is yet to come. So you just hang on in there and you go where the path leads you, because I see you doing great things in the future. And like Dr. Trujillo and I was just talking about, you're just getting started, you know. So I see a lot of great things happening with you, and you leading the way in the future there as well. So thank you so much for being on the show with us. And I want to give everybody the opportunity to be able to first learn a little bit about you. You know, I didn't have the opportunity to go to school with you as I did with Dr. Trujillo, and enjoy the great jokes that you probably hear him giving out there at TEI. But if you could tell us a little bit, why did you choose optometry? Why optometry? I know you and your family, you moved, you know, from Cuba, you're in Florida, you got your degree, you went to a great optometry school. But why? What led you to choose optometry as your career?
Yeah, so there really isn't a big history in my family for medical field at all. I'm actually first generation in my immediate family. I knew I always wanted to serve my community some way, somehow. Honestly, I didn't want to take the route of med school, but I wanted something in the realm of it.
Yeah.
So I was definitely looking into things like pharmacy, dentistry, one of those career paths. Thankfully, so my mom is a pharmacy tech. I grew up around pharmacy and pharmacists, that entire environment, and I was able to shadow them, which I think is an invaluable experience for any young student who's looking to find their path.
Right.
With that, I realized I didn't feel like it was enough for me personally. I craved that patient encounter, spending time with them. So thankfully, that doctor went to Nova in Florida, where she had other student friends, colleagues who were doing optometry. She had me shadow one of her friends, and I realized that was it for me.
Right there. Wow, that right there hit the nail on the head. You know, you said something that was important. Shadowing, shadow. If you're listening, you're a parent, you have a child who's in high school, that's the perfect time to start shadowing. Whether they want to go into real estate, or if they want to go into optometry, or they want to be a dentist, uh, allow them to shadow in that field of interest there, because as she said, that will allow them to find their path, to be able to find their interest, their passion. We want them to wake up every day feeling good about going to work, you know. And with Dr. Cardo having that opportunity to be able to shadow into pharmacy, and then moving over and shadowing someone into optometry, she made a connection there. And
100%.
how do you make that connection into the cornea and contact lens department?
Yeah, so I initially, when I was starting to look into optometry, I thought I was definitely going to end up in peds. I always liked working with kids. However, there was more. It was not enough for me. I started learning about pathologies, diabetes, glaucoma, things like that. So I definitely wanted something a little bit where I could see a broader population. One of my mentors in school, one of my preceptors, he's my current chief. He's the chief of the contact lens department at the Eye Institute. He really took me under his wing, sorry. He would fit me in any contact lens I wanted to try. He would have me shadow him. I would be there even when I wasn't assigned in clinic, just trying to see. And I really grew a passion for it. I realized there's so much and so many people that we can help. It's a very rewarding field in the sense that glaucoma, diabetes, some things like that, it's not something that I myself can't fix right away. It requires other specialists. Their PCP needs to be involved, things like that. Glaucoma, when it's in end stage, there isn't a lot more that you could do other than set you up with low vision, different departments and things. For me, in contact lens, I found that it was such a satisfaction to get a patient from 2400 to 2040 even, and how grateful that would be. Or even myself, I'm a very high myope, and doing ortho K really became an interest for me. So that's my way of staying with peds, doing myopia control and management. And yeah, I mean, everybody, I feel like a lot of people don't know, a lot of patients, a lot of providers don't always know how to deal with specialty lenses or more complex cases. And I really wanted to hone in on those skills.
It is much needed. A lot of specialties, there are specialties for the cornea, there are specialties for glaucoma, vision therapy, just pediatrics in general. The specialties are needed because a lot of optometrists are not comfortable, or they are not interested in going deeper in that one particular area there. So I applaud you for taking the step in a direction that many optometrists do not take there. And I also know that when you bring someone from being 2400 to 2040, that's like taking them out of darkness into the marvelous light. And that's great, and contact lenses allow you to do that. Keratoconus, you can go really deep into the different conditions and disorders that people have, where they have to have specialty contact lenses in order for them to be able to see better. And I think you're going to continue to find it rewarding. And I don't think you will have a day where you won't have patients, even if you decide to get your own practice, because it's needed. Especially, I had the opportunity to work with Dr. in Augusta, and we did a lot of fits for keratoconus. We had a lot of hard contact lens patients coming in and hybrids, and so we saw quite a bit of patients there, on top of seeing patients for medical reasons as well, glaucoma, diabetes there as well. So continue to do what you're doing. I think it's going to be great, and I can see other students coming to your office for their internship there, following you and learning from Dr. Cardo, so that they too can be a great optometrist in the community there. So when we graduate from school, we have the opportunity to do different things. And you decided to stay with the Eye Institute there in Philadelphia. What drew you to making that decision at TEI?
So definitely, cornea contact lens is a pretty competitive residency, but I always knew that I wanted, again, not just one thing. It's hard for me to stay still. It's hard for me to do one thing every day all the time. At the Eye Institute, we have such a special population. We see all sorts of things, a big underserved community. And unfortunately, that's really where you learn, I have found through my career as a student and now as a resident, the things that walk in through emergency, your patients who came for an evaluation for contact lens or keratoconus, and you look at the back of the eye, you're like, oh, but you also have glaucoma and diabetes and this and that. And the Eye Institute, or our program for cornea and contact lenses, is very strong in that. As you mentioned before, I work with Dr. James Lewis. He has a pretty much full scope, despite him being mostly NSEG cornea specialist. I still see so much there. Our patient volume is 50 to 60, 70 patients a day. And there's no way, just with our location, that I'm not going to see things, that I'm not going to learn something new every single day. And I just thought some of the students are like, why would you stay in the same place? Or why not a change of scenery? And I definitely did consider it. Initially, I thought that it was really going to be my path, just trying something new. But there were so many stones still unturned where I was, that that's what I went for.
Wow.
Don't regret a single day. These past 6 months have been the best.
At TEI, the Eye Institute, you will see a wide range of cases, different things on what their prescription is there. So
this is at the Eye Institute. Even today, I was trying to get cards from our neuro and low vision, and just because we have the opportunity to collaborate a lot, and it's wonderful when you could guide the patients to where they need to be, because I could only get so far with a contact lens, but they still need a low vision, or yes, we've maximized your vision potential with this lens for whatever condition, but we still need somebody to look at your pale nerve, or it's great to have all those resources at hand.
Yeah, it's beautiful. Yeah, that where you don't have to send them, downtown Philadelphia, they just send them around the corner to another department and say, hey, I need Dr. So-and-so to also look at this with you. And the patient is, they're already familiar with that location and not having to go somewhere else, like we will have to do, in a private practice there. And how I noticed that you said you were in your bio, well, I don't know if in your bio we're just talking, first one in your family, because you don't have a lot of medical background in your family. They're your first generation. Myself, included, was the first to go to college out of my family and graduate there as well. So how does it feel, to be a first generation doc in the family?
I guess the most rewarding feeling is feeling like I'm giving back to my parents for bringing me here. That is always my ultimate goal, making them proud and being grateful for everything they've done and sacrificed to get me where I am now. And it's a feeling like no other.
Yes, I know your parents are proud of you, and I know your family, they're smiling when they see your name on social media platforms there, and they get a chance to talk with you and see how things are going. It's the holiday season, so I hope you get the opportunity to be able to, visit your family or see your family, over the Christmas holidays there, and share your experiences there, because when you're at a place like the Eye Institute that has so many cases there, and they're doing so much in the community, you always have something to share with your family there. And that
my mom
brings me
doesn't
to
expect those phone calls every day. My ride home is all, so what did you see today? What did you do? Always an update.
Right. And then just looking at you as a resident, and trying to stay focused on that, your extracurricular activities, your personal life, social, how do you balance it all? Because it's important, no matter what you're doing, even if you're not a doctor, you're listening to this webinar, it's important to have life work balance there. So are there any tips that you could share, what has been helpful for you when it comes to balancing those responsibilities?
Yeah, it's definitely been a learning curve. I think mostly transitioning from being a student and knowing that your time isn't yours. You get home to do what you got to do. It's hard to find that balance now where, yes, you clock out, but you still have contact lenses to order or patients to follow up with. But also, I think it's definitely been a blessing with my co-residents. We're such a big group, and our class in particular, we're very closely knit. So we sort of push each other to take a breather. Let's go do something. Let's go watch the Eagles game when you're done with that. It's things like that. Even today, I had to rush over from a conference. There's always something going on, but we really help each other, and it's great to be going through the same things as other people, those closer to you. Keep each other grounded, help each other stay on track, and just take a breather when needed.
Yep. So I'm in the South Carolina, and I went to Philly and got my first experience of being in a cold atmosphere, cold place, snow, thinking that when the snow is on the ground, school is canceled, but that didn't happen there. You coming from Florida, I'm thinking warm there, Miami, Florida. How has that transition been for you moving to Northeast there in Philadelphia?
It definitely was a change, to say the least. I would say the thing I miss the most is my beaches. And I know Jersey is an hour and a half away, but I personally can't compare the two. I would say, if anything, COVID was the harder part of it. Just being so isolated, really there wasn't much I could do about it. But thankfully I had family in Canada that I visited growing up, so it wasn't my very first impact with cold and things like that. But you really have to learn to adjust the mood changes and the dark early days and things like that. Always finding somebody to spend time with, doing something, getting out of that cycle of like, this is new, this is weird, this is uncomfortable. Just embracing it. I'm ready for my snow. I want something to look forward to. I want to look out my window and see pretty white. We'll see. I'll probably miss it when I leave, the seasons and things like that.
And I love that you mentioned your network, that you are connected to your colleagues there. You guys have that teamwork, accountability. You know, someone to say, hey, let's go do this, or hey, let's make sure we get this done there. Keep that going. You know, that connection that you guys have there of keeping each other connected and on track with things there. I look also at the fact that, and I appreciate you for being on this show here for the National Optometric Foundation as a Hispanic optometrist, you know, and many times there we want to make sure that we give back to our community. In your field of optometry and eye care, have you been allowed to be able to do that? Have you done any sponsoring events or participated in any events where you've been able to give back to your community in any way when it comes to eye care?
100%. I think that was also one of the motivating factors to stay up here because, yes, Miami's home, but I'm not the only Hispanic doctor probably in a radius. Right. So being here, I really had the opportunity. Ever since I was a student, I'd be the one that would get pulled into an exam. Can you help us translate this or that? Even my fourth year where we do our specialized rotations. Mine was primary care and contact lens, and that's where I got the opportunity to work with Dr. Trujillo. I would sign up specific and like switch shifts with other students so I could go to Norristown, that the clinic that he was talking about. And I absolutely loved it. I love the opportunity to explain to my patients what is going on, probably things they have never really comprehended. I've had patients, for example, with glaucoma taking drops and they're just like, I don't take it or this or that. And you can tell it's because they don't understand the severity of it because they've never had the opportunity to ask questions or understand the mechanism or like what's going on and why it's important to do this or that. And I think it's a wonderful opportunity when I get to do things like that. And to this day, like, I get phone calls to translate during exams from my co-residents or colleagues or students, and it's really something.
You're a valuable resource. You're a valuable resource to the network there at the Eye Institute. So that's fabulous there. And the clinic you're talking about is that federally qualified health center. Correct. That Dr. Trujillo was mentioning earlier, funded by federal government. Someone that doesn't have insurance, they can come and get their eye care and needs met, getting their drops that they may need. That's another valuable source in the community. And while we continue to encourage people to join us optometrists, join your local community, join the National Optometric Association and the foundation, serving underrepresented, underserved communities there, especially, we're talking tonight about cornea and contact lens here with Dr. Cardo, but also just 3 silent killers of your vision: glaucoma, diabetic retinopathy, and hypertensive retinopathy. Just making sure that we're helping to educate the communities, catching these things early so that there can be intervention, treatment, management, and care for our patients there so that they don't lose their vision. We are trying to preserve their vision there. And Dr. Cardo, I'm thinking about you as an optometrist there working at the different facilities and healthcare centers and the Eye Institute. What has been your favorite? Do you have a favorite case? I don't know if it's a contact lens or a cornea case that you've worked on so far that you would like to share with our listening audience tonight.
Yes, I have quite a large one, but there's one patient in particular that I just love this case because I actually met him at Norristown when I was a student, and I've been able to start. So he had a previous diagnosis of keratoconus. His contact lenses were no longer working for him. And again, these are patients mostly who don't have insurance and the same opportunities that a lot of others do have. So he had been wearing the same contact lenses for 5 years. It wasn't working for him. I referred him to the Eye Institute, where we really, even there, we work a lot with our patients, payment plans. I personally have contacted multiple companies. I write up cases, or I'll do a poster for you if you help me get these contact lenses for this patient, things like that. There really are many resources out there for us as providers to help those who need it most. So this one patient, I don't, he even has my personal contact at this point. If he has a problem, he knows how to reach me, because I was able to start his fit with him as a student. I was obviously, he would schedule when I was scheduled there, just because it was easier for him to communicate with me, completely Spanish speaking. Then when I came back as a resident, it was his 1 year 1 year exam was due, and I was so excited to be able to see him on the books, and they were so excited. Him and his girlfriend were like, "Oh no, you're back." So yeah, that was really a blessing to be able to follow up and just take care of him, continue his care, and we've done great things for him, and he's been an inspiration and a motivation for me to continue doing this.
That's great.
Yeah.
That's great. And I know sometimes that, that's great that you had that connection with that patient there. Doctor-patient relationship, I think, is very important there. No matter what we do in life, I think we always need to think of it as a relationship business there, because when we start to get away from the relationship part, a lot of things go in the wrong direction there. As I was talking with Dr. Trujillo about ethics, and making sure that we are doing things to benefit the patient, and making sure that we are doing no harm to the patient as well there. So I think we need to always stick to the relationship and know that that's very important, no matter what you're doing in life. I was just thinking about different things that you can do, different careers, but the relationship is important, whether you're in the restaurant business or if you're a school teacher, are you the CEO of a company, you need to have a relationship with your staff, your employees there as well. And I'm so glad that you were able to make the connection there with that patient, helping on their keratoconus history, because we definitely know that when the front part of the eye, the cornea, is to the point where it's so steep, you can't do anything really to help that patient see well with, but to do contacts or a cornea transplant, it's important that you work closely with that patient and try to help them as best as you can. So thank you so much for doing that for that patient there. Do you find yourself challenged with any of the cases there? Some that's really challenging for you so far?
Yes, there's a patient. Also, I'm a magnet for these patients too. He's also Hispanic, and he had trauma to one of his eyes. He's aniridia, aphakia, so no iris, no lens. Very complex fit. We had to do multiple lenses, actually, piggyback system in that one eye. The other eye we fit because he also had keratoconus, so fit the other eye. Then he keeps on having macular edema and other conditions. So that goes back to me calling my retina doctor who lectures to me, like, can I send you an OCT? Can we consult on this before I get him to you? And just try to manage the patient. I fix the lens on one end, then the other eye gives me problem with something else. And then but the glare and this and that. It's just working with various things at the same time, but bring it on. I mean, that's what I'm there for, and I enjoy it.
No challenge, no reward, right?
Yes.
That challenge, and when you're able to get to a solution, it's so rewarding, knowing that you were able to help someone that was in need, and you went through all of these different steps, and you put a lot of work into it, but it was helpful to that patient there,
And I'm my own worst critic with my patients. If I know you can't be 20/40, but I'm still trying to get you there. 20/40 is not enough. I want you to 20/20, but if I know realistically that's not it. But they know I won't stop, even if it's a minor change. If anything I could do to try, I'm there for them. this is what I love. So
Well, that's
it's
good.
as rewarding to me as it is for them, I would hope.
Yeah, and I hope to have you, in the future, back on the show. I can share, Dr. Trujillo, he has my personal information later on the show, on a different topic, and everything. You might can have the whole show just talking about the cornea and different cases that you may have experienced, or just contact lenses and keratoconus or whatever. But we would love to have you back on the show in the future, in 2024, maybe near the middle or the end. Again, there just to share with our listening audience. I think you bring a different perspective. You're representing the Hispanic community as well there, and I appreciate you for taking your time out to do this for us tonight. And if there's one thing that you would like to share with our listening audience there, a word of inspiration, or maybe something about them attaining professional goals or things of that sort, what would it be?
Definitely go for what you love to do. It sounds cheesy, but when it's true when they say you won't work a day in your life if you love what you're doing. And for patients, find that doctor who you connect with. Find that second opinion if you're not sure about something. Really be you are your biggest advocate. So don't give up. There's always somebody who can help you some way, somehow. There's resources for providers, patients, just find the right ones, and we could all help each other.
Absolutely. Thank you. You said a mouthful there, Doc, and we'll bring Dr. Trujillo back on the screen here as well with us as we're closing out the show tonight. Go for what you love to do, so it won't feel so much like work for you, and making sure that patients also, make sure that you're speaking up and speaking out, being an advocate for yourself. If you have a mom that's elderly and they're going to an appointment, go with them, so that you can listen and you can speak for them as well. There are many times when I was at TI, patients would come in, without someone, and then we have patients that actually come in with someone, who's there to help listen because they don't always remember what the doctor may be delivering to them there. So I think that's important as well. And I appreciate you, Dr. Cardo, for sharing about yourself, your story. We did have someone in YouTube that I'll mention here, Joanna Anderson. I really enjoy your talk and sharing your story. And also Joanna Little. She said she loved your story and your purpose, Dr. Cardo. So see,
Thank you.
Go. Making an impact in the most positive way there. So as I said, keep growing, keep sharing, keep doing what you're doing. You're at the beginning stage of your optometry career, and like I said, the best is yet to come.
Thank you. Thank you so much for having me.
Absolutely. And I don't know if we have Dr. Trujillo there, but Dr. Trujillo, Dr. Cardo, I really appreciate you both for being on the show. Dr. Trujillo, I wanted to give you a chance if you had some closing words that you would like to share with our listening audience. You can do so at this time, and we can close out the show for tonight.
No, actually just wanted to reiterate what Dr. Cardo said, do find something that you love to do and, do it. And I didn't quite catch the entirety of the comment there, but I'm sure it was a positive one. And I think I agree with it. She's a success, like I said, she's a success story, and her story is one that's something that inspires even myself. So I think that if more people that are in her position can actually just find something that they love, and like she's a doctor, she's doing residency, that automatically already puts her in a level of the higher than a lot of doctors who didn't complete. It's just it's like I said, she's a success story, and I think that there's she's just getting started, and the best is yet to come. And I agree, find something that you love and go for it.
That's right. Come on down to Augusta, Georgia. You can easily get hired here in Augusta. And look, Augusta is a lot closer to Florida than Philadelphia.
No, you're not wrong.
To you both, thank you. We appreciate having you on the show, the National Optometric Foundation. Really appreciate you for taking your time and sharing your wisdom here, Dr. Trujillo, Dr. Cardo. And we look forward to having you both back on the show, maybe in 2024 as well. So thank you, and have a great evening. So my name is Dr. Timothy Brown, the treasurer for the National Optometric Foundation. And once again, I want to thank you guys for listening in to Protecting the Vision as we talked tonight and shared with two great speakers, Dr. Trujillo and Dr. Cardo, speaking about their experiences as healthcare providers, not only just at their location where they're working, but out in the community as well. And that is what we try to do here with the National Optometric Association and the foundation, teaming together to support the community, educating the community about the 3 silent killers of the vision, providing eye exams and glasses for the community. We want you to know that you can follow us on the National Optometric Foundation to learn more about what we do. You can see our photos that we have posted on our website. You can also be a part of us on our Facebook page, National Optometric Foundation, and then also the webinars that we're doing tonight, we've done in the past, and we're going to do in the future is on our YouTube channel, National Optometric Foundation as well. And if you, like many of our sponsors have done, donating to the foundation to allow us to keep doing the things that we do, supporting students in optometry school, thinking about going to optometry school, you can contribute tonight. Yes, we have a Cash App, and you can send your donation there. We are a nonprofit organization, and your donation can be tax. You can write it off there, tax deduction, $ Protecting the Vision. Send those donations, even if it's just $20. That will help more than you realize there. So your donation doesn't always have to be huge. Again, thank you for tuning in to the show. My name is Dr. Timothy Brown, NOF Treasurer, and we'll see you in 2024. Have a Merry Christmas, guys. Have a Happy New Year, and I'll see you on our next webinar in January.